We're at the Joint Conference Budget Committee on Health today, and we have Carin Tinney from United Neighborhood Houses. Carin, would you explain a little bit about what you're testifying today and recommendations that you're going to have to the Health Budget Committee?
Sure. Again, my name is Carin Tinney. I represent United Neighborhood Houses. Just so a little background, UNH is a federation of 37 members, which are both settlement houses and community centers around New York City. We serve everybody from the age of 0 all the way up to 105 using a neighborhood-based approach. Today we're testifying on 3 major areas of concerns that were raised by Medicaid redesign and also the executive budget regards to seniors. The first thing that we're going to be testifying on is we're going to ask the legislators to restore funding to the naturally occurring retirement communities and the neighborhood naturally occurring retirement communities. So it's NORCs and NNORCs. The governor's budget cut these programs by about $228,000, $500 each, so a total about $457,000, which is 10% of the budget. Just so you know a little bit more about NORCs, they are residences where seniors have aged in place, and the service delivery is now within the building to the seniors who live there, meaning the nurses do screenings and assessments, provide social engagement opportunities right in the person's residence. So it's also really important for care management because the people who work in the NORCs see residents daily and they can catch problems earlier, a decline in health, a decline in mental health status. If they haven't seen a resident for a while, they know to go check on them. So we think they're one of the best inventions in the 20th century for long-term care in the community. So we're going to ask the legislature to restore this funding to the 08-09 levels of $2.2 million each.
Great.
The second thing that we're going to be testifying on is the Medicaid redesign team targeted personal care services in New York City. There are roughly about 60 home care providers providing home care services to frail elders and disabled people through the HRA, Human Resources Administration in New York City. They're going to be transitioning about 36 to 40,000 clients into managed long-term care plans. When this is happening, the home care providers who've been in this system providing services, critical services to the consumers, are facing what we're calling destabilization of reimbursement. In the old system through HRA, they were receiving about a reimbursement of $17, $18 an hour in order for them to pay a living wage to direct care workers of $10 an hour plus about $2.50 in benefits, and along with that, insurances that go along with that, earned leave, workers' compensation, all of that. In this new system that they're going to be transitioning to, the reimbursement rates are going to be about $14 to $15 an hour. Our guys do not want to lower wages to the direct care workers. They've seen that the living wage stabilizes the workforce, provides decent salaries so that these women, mostly primary women, can afford to work and live and take care of their families. So we're advocating for the reimbursements to remain about $17 to $18 an hour so these providers can continue to pay decent wages and benefits. At the same time, we're asking for the home care providers outside of the system of HRA to receive about the same benefits, a reimbursement range from managed long-term care plans and managed care plans of about $17 to $18. They're going to be following under the home care worker parity rules, which raises the wage floor for the other direct care workers in the systems over 3 years. So they'll need adequate reassessment.
Okay.
So that's I have one more thing that we're advocating for today. We're asking the legislators to oppose the elimination of spousal refusal in the budget. Spousal refusal, forces couples to. Right now, spousal refusal is in effect. A spouse can refuse to count his or her income towards their disabled partner's Medicaid eligibility standards. It's a really great thing so that the person who is the well spouse doesn't have to impoverish themselves in order for somebody to get home care and long-term care services. The governor has proposed to eliminate spousal refusal in the community. What this sets up is a couple choosing Medicaid or marriage. A lot of couples, in other states who do not have this, divorce in order to get Medicaid. The other thing it does is that spousal refusal is still going to be in effect in institutional settings. So it's going to be the question of nursing home or marriage. So we don't want people to have to make these really critical decisions. We think that the governor should eliminate his proposal to eliminate spousal refusal, and we're asking the legislature for support in this.
Okay, thank you very much.
Thank you so much.